We've been covering what's going on in the UK for a while because not only are the wait lists incredibly long for trans people, like the wait lists are illegally long for trans people to get care. If you need a specialist, then you're supposed to get care within like 18 weeks of your referral from your regular GP. And yeah, so we've been covering that for a while. We've also been covering the increased hostility toward trans youth in particular, like hostility toward trans youth having access to healthcare. These claims that, oh, we haven't proven that this is good healthcare. We need to have more studies. There need to be more studies done on it. And kind of the UK has been moving in this direction where at this point, I believe they have pretty much officially paused all youth healthcare for trans-related reasons, unless you are one of the people who they've accepted to be in like the clinical study about it. Like you have to join basically a pharmaceutical study in order to be able to be on puberty blockers as a teenager in the UK. And that's to say nothing of going on hormones, because I don't think that this clinical trial has anything to do with cross-sex hormones. I think it's for puberty blockers only. So lots of trans youth have taken heart from the fact that you can get this healthcare privately. Like the NHS, the National Healthcare Service, is public. It's taxpayer funded. Everybody gets access to healthcare for free over the NHS. But for some things, like if the wait list is 5 years long, but you're a teenager and you need this medicine now, and you don't want to have to start over on a brand new wait list after you turn 18, then hey, you might do something like go to Gender GP, which is a private healthcare institution. It costs money that, you're already paying taxes for healthcare, but they're denying you the healthcare, so you have to go pay extra for it to get it privately. But you can get a diagnosis of gender dysphoria or whatever it is specifically that they call it in the UK, and you can get the healthcare and not have to do the wait and not have to jump through the hoops that they make you do in the regular system. And there are some people, I'm sure, who are engaging in the gray market and like buying estrogen, even like not from Gender GP, but just buying it online. And there are probably people who are actively breaking the law by buying testosterone online. This is what happens when you get denied the official healthcare, At least Gender GP, it's still like a legal process. It's still like a doctor is prescribing you the thing. So it doesn't exist in a gray market or a black market. But apparently the NHS is now preparing to crack down on any trans person, like any trans child or trans young person who is getting this care through other means. So this is there's a couple of things here. There's a crowd fund taking legal advice on mental health guidance for trans youth. The Good Law Project has seen an alarming leaked document from NHS England regarding children and young people's healthcare. The document, which does not bear the name of any NHS professional, asks providers of mental health support to children and young people to invite those on the national waiting list for gender services for a face-to-face appointment. Providers are told, quote, "We request all CYP who have been allocated to your service for mental health review are assessed as soon as possible. As part of this process, children and young people on the waiting list for trans healthcare have been sent a, quote, gender experience summary form asking them or their families whether they are receiving support from, quote, the private sector or from abroad, such as hormone treatment. And as part of this assessment, providers are asked to, quote, advise the child or young person that their parent and their parent/carer not to take puberty blockers or gender-affirming hormones obtained through these routes without, quote, appropriate care," as though Gender GP isn't appropriate care, apparently. NHS England does not identify what, quote, appropriate care is, and it is hard to see what available care it would describe as regulated. Providers are told not to prescribe or to stop prescribing puberty blockers or gender-affirming hormones. They are also told that if the trans child or young person or their family disregards your advice and you consider that this puts the child/young person at increased risk, then a safeguarding referral may also be appropriate in line with standard safeguarding approaches. So basically what they're doing is saying we're saying these kids who are on the waiting list, so these kids are waiting on the NHS list to get this healthcare. And now the NHS was happy to leave them languishing on a wait list for 5 years But now they're like, oh, you know what? We need to do a little mental health assessment. We need to do a little visit with you. And part of that visit is demanding to know whether those children and their families are seeking this healthcare through other means, and then saying, you need to stop doing that. And then saying, if you don't stop doing that, we will open an investigation. There will be social workers. There may be police. We will go into your home and determine whether you are a safe parent. And we might basically force you to detransition. And now this is alarming. Is this document real? That's the question. Like, is this real? Is this for real happening? So this tweet over here, it's reasonable to describe this as an attempt to force trans people to detransition. Quote. So this person, Jamie, says, yesterday I spent the day on and off the phone with NHS England, who have finally confirmed leaked documents from the Good Law Project are in fact real and in use. What we know currently, NHS England is going to give 6,000 plus trans children advice that may leave them with no choice but to medically detransition or face safeguarding referrals, according to these leaked plans, which has now been confirmed. The documents say that if young people and families are using, quote, unregulated or overseas providers for gender-affirming care, they should stop. And if they continue without, quote, appropriate care, they may face safeguarding referrals. So again, this is coming from the people who want you to wait until puberty has done all its damage before they will offer you any medicine. Yeah, these breadcrumbs, those were way too much. You have to suffer even more. Outlawing the healthcare does not, in fact, make the healthcare need go away, only the safety. Yeah, you're pushing people to use alternate means to get the medicine. And then you're saying, yeah, but if you do that, we will actually open an investigation on your family. And like, what does that involve? Does that mean that if the parents are providing the care, the parents can be jailed? Does it mean that the children might be taken into state custody? It's really unclear. If you're enjoying this video, hit the like button, maybe subscribe, hit all notifications if you want. Feel free to check out the links in the description. You might find some merch you like, or you can hit up the Patreon to support the content and find free stuff. When I first figured out I was trans, it was almost impossible. It took years to get the process going to get hormones. Where I live in America, most trans people were buying hormones illegally back then. These laws will just make people get those things illegally again. Yeah, so it's like you have to lie. I guess you have to lie if you want to be safe as a trans person. You know, they're going to fast track you to a mental health check-in. Ooh, you finally get your first appointment. Isn't that so great? And then they're going to ask you if you're already on the medicine. And the way that this usually works in the US, at least, as far as I understand it, is that if you're already on the medicine, like let's say you're buying it on the gray market, you're dosing yourself at home. I think in the US, a lot of doctors, because it's harm reduction, will say, holy shit, I'm just going to give you a prescription for this. Like, especially if you're in an informed consent situation, they'll go, oh, you're clearly going to access this care anyway, so I need to give you it safely, or you're going to continue taking it in a way that is unsafe. Jamie continues, what's the implication? Quote, the consequence must be that no young trans person should be taking medication. That is the NHS's apparent view. I think it's reasonable to describe this as an attempt to force people to detransition. The documents ask providers of mental health support for children and young people to invite them, the ones that are on waiting lists, to have face-to-face appointments. Some providers have been asked to complete these assessments by 30th June 2024. They are fast-tracking this. They're trying to get 6,000 children waiting. Oh, so you've been unable to process all of our first appointments so far, but now that you're wanting to like make sure that we're not doing the thing that you don't want us to be doing, like, oh, suddenly you're going to fast track and do 6,000 assessments in the next month? Process requires people to fill out a gender experience summary. Yeah, whether you've been receiving this care from somewhere else. Yeah, assessment providers will, quote, advise children as per the recommendations of the CAS review, which is under heavy scrutiny right now, not to take puberty blockers or gender-affirming hormones. A safeguarding referral in line with standard safeguarding approaches. As I understand it, safeguarding referrals will be a, quote, last resort. However, it is unclear what the criteria are to reach that stage or how subjective the concept of, quote, appropriate care is. The implication of this process is if a young trans person decides to pursue private gender-affirming care and their parents support them, they could be referred to local authorities. The letters frame this assessment as offering, quote, enhanced support while they are on the waiting list. But that's not just what the exercise is about. Oh yeah, we understand it cannot be easy for this person to have to wait a long time to be seen by specialist services. Therefore, the NHS is offering you some additional support Some additional mental health support. Jamie's take, he says, Yes. He says, any attempt to force, ask, or create pressure to consider other reasons for your sexuality or gender identity is a form of conversion therapy. If this plan is found to have been signed off at a state level, that has a huge implication. So yeah, TLDR, the guidance is in use by NHS England. 6,000 children are being invited to these, which are alleging to be support, but are actually just gathering information. And you'll be officially advised to stop getting gender-affirming care. NHS England has sent a full response. They say this approach is about putting in place, quote, an enhanced mental health support offer. And this is crucial. They said it's optional to engage in this process. NHS England has put in place an enhanced mental health support offer for all children and young people under 18 on the waiting list for specialist gender services or who are awaiting their first appointment with the new services. They added patients will be given the choice whether they want to take up this support offer and whether the outcome of their appointment with a mental health professional, their place on the waiting list for the gender services will not be affected. If you say so. Yeah, if you're gonna like take forever to give these kids, like, okay, why are you not just fast tracking the first, this is like a first appointment mental health thing. If you are forcing these kids to go through psychiatric evaluation before giving them transition related health care, why are you not just giving them that? Why are you not just giving them their first appointment in the process of getting puberty blockers? Why are you fast tracking a wellness check? Like, if you're capable of processing 6,000 children in a wellness check midway through them being on the list, what is stopping you? Aside from deliberate, willful, bureaucratic nonsense, overt, abject transphobia, what is stopping you from just processing these children and getting them on the fucking healthcare? I mean, because they don't want them to be on it. That's what it comes down to. They refuse to provide it on the NHS. They are going to now crack down and investigate your families if you go do it privately or if you mail your medicine in from fucking Canada or something. Yeah, how many of those kids will commit suicide? We already know there are plenty of people. Like, I don't even know the exact number. Frankly, I wonder, I feel like there should be like a subsection of transgender day of visibility observed in the UK for specifically those who have killed themselves waiting for this care. Because I am going to just put a guess out there and say that it's at least dozens of people over the last, not even 10 years, because they used to be way, way, way better at providing this care. Like the last 5 years, let's just say, how many dozens of trans people have killed themselves waiting for this care? Like, this is a travesty on the NHS. This is a crime. Like, even if it's not legally in the construct of the legal system in the UK a crime, it is a crime against humanity. Making a deliberate choice to torture children. Torturing children. Forcing them to wait. My back is getting sore. Yeah, can we please call up The Hague? Trans people are just the last group that anybody gives a fuck about. So it's kind of hard to get any momentum on this stuff. Like, when the entire global West apparently has decided to become barely better than, like, remember the videos that you used to see of like gay men being pushed off the top of buildings in like Middle Eastern countries? Just, we are exactly like that, but we don't like the optics of pushing people off of buildings. That's exactly what we are, though. Just like only this much marginally better than countries where it's literally the death penalty to be gay. This is the social murder aspect of it all. They can't put the death penalty on trans people because a lot of people would freak the fuck out about that, but they can slowly pressure you until you kill yourself. That's totally legal. That's totally fine. People will even say, oh, well, we need to put more funding in the NHS. You can kill people and get more funding. Yep. Transphobia with manipulative extra steps. Thank you so much to all of my patrons, especially Tiago Nascimento, Mersh Rolvag, Michelle Frateroli, Amanda B., Michelle Winter, Wellington Marcus, Danielle McDonald, DZXN, Suzanne Maynard, Spooky Heather Sylvia, Ella V. Nobody, Pastel Infinity, Jamie Jam, Nova, Sojo, Elizabeth Bartell, Kevin Young, Athiette, Celeste, Desi Quiche, Liam Hodgson, Mr. Atheist, and Jack.